Ever had that feeling? Something's just off with your dog.
Mm.
Maybe they're a bit slower, a little stiff getting up, and maybe there's this fever that seems to come and go.
Right, plays hide and seek.
Exactly. And like any good pet parent, you probably hit the internet. And maybe this word popped up, hepatozoonosis.
Yeah, that sounds pretty serious.
It does. So what is it exactly? That's what we're tackling today. We're digging into the latest veterinary info to really understand this thing in dogs.
Yeah, absolutely. And we're focusing specifically on a systemic infection caused by this tiny protozoan parasite. It's called Hepatozoon americanum.
Okay.
That's the main driver behind what we call American canine hepatozoonosis. Now, there's another one out there, Hepatozoon canis, but it's much less common and generally not as severe here in the U.S. So for this chat, we're really zeroing in on Hepatozoon americanum.
Got it. Hepatozoon americanum, the main culprit here. So where in the dog's body does it cause problem?
Its main targets, muscle and bone, primarily muscle and bone.
Muscle and bone, okay.
And, while cats can technically get hepatozoon, it's incredibly rare in the States, like one reported case ever.
Yeah.
In Hawaii.
Wow.
So, yeah, this is overwhelmingly a dog thing.
Okay, so mostly dogs. And you mentioned the U.S. Does it tend to show up in specific areas?
Precisely. Yeah, you see it most often diagnosed in dogs down to the southern and southeastern United States.
Okay.
And what's interesting is it doesn't seem to pick based on age or breed or even sex.
Really?
Nope. Any dog in those areas could potentially be at risk.
So if you're living in the South or Southeast,
Whoa.
what are those first signs? What should you, as a dog owner, be watching for?
Well, the clinical signs can be quite distinctive sometimes. Lameness is a really common one.
Lameness, okay.
And you might see your dog develop this kind of stiff way of walking, a stiff gait.
Right.
Another big clue is a fever that just comes and goes, that waxing and waning pattern.
Uh-huh.
You might also notice, like, a gooby discharge from their eyes, often yellowish or greenish. Yeah. And sadly, some dogs get really sensitive to touch. We call it hyperesthesia.
Sensitive, okay.
And maybe unexplained weight loss, just looking generally thin, wasted, cachexia.
Those all sound like things that would definitely make you worry. Are there any less obvious signs, maybe?
Yes, sometimes. If the kidneys get involved, there's a condition called glomerulonephritis.
Okay.
Then you might see the dog drinking a lot more water and urinating more often. Polyuria and polydipsia.
Okay, right. So we've got a picture of what it looks like, who it affects. Now, the big question, how does this parasite actually get in? What causes it?
Right. So the main way dogs get infected, it's by actually ingesting the Gulf Coast tick.
Ingesting, you mean eating it?
Eating it, yeah. Amblyomma maculatum. That tick carries the parasite. So it's not the bite itself. It's the dog swallowing an infected tick. Kind of unpleasant, I know.
Wow. Yeah, not a great image. Are there other ways? Any other scenarios?
There is another potential route, yes. Dogs can get infected if they eat what we call paratenic hosts.
Paratenic hosts? What are those?
Basically, another animal that's carrying the parasite but isn't the tick. So maybe the dog hunts and eats, say, a rodent that's infected.
Oh.
Or scavenges on a dead animal that happened to be infected.
Right. Okay. So if your dog shows some of these signs and you take them to the vet, how do they figure out if it's this and not something else? Because some of those symptoms sound like they could overlap.
That's a really, really important point. Diagnosis isn't always simple. It's often a process of elimination.
Right.
We have what we call differential diagnoses, all the other things it could be.
Like what?
Oh, things like cancer, certain heart infections, immune problems affecting joints or muscles, even other parasitic diseases like Chagas or leishmaniasis.
Wow.
Yeah, and neurological issues, maybe meningitis, certain bone diseases, other tick-borne stuff like ehrlichiosis, spinal infections.
Yeah.
Even liver failure can sometimes look similar.
Okay, so it really underlines why you need a vet to sort this out.
Absolutely. You need that professional diagnosis.
So what tests do they run? Blood work, I assume.
Definitely. Blood tests usually give us some pretty significant clues.
Wait.
Like often a really high white blood cell count, sometimes dramatically high.
Okay.
And it's usually a specific type, neutrophils that are way up.
Yeah.
We might also see some mild to moderate anemia.
Anemia, right.
But interestingly, it's usually non-regenerative, meaning the body isn't actively pumping out new red cells like you might expect. Platelet count. Usually normal, unless there's maybe a co-infection going on.
Okay.
We also often see high levels of an enzyme called alkaline phosphatase, ALP. And here's a weird one. Even with all that muscle inflammation,
Yeah.
Another muscle enzyme, creatinine kinase or CK, is often surprisingly normal.
That is interesting.
And finally, blood proteins, you often see high globulins and low albumin.
Wow, okay. Lots of potential flags in the blood work. Anything else in the blood?
Well, sometimes, though it's rarer, you can actually see the parasite itself.
No.
Yeah, inside certain white blood cells, neutrophils, and monocytes, when you look at a blood smear under the microscope, like catching it red-handed.
That'd be pretty definitive.
Yeah.
What about things like x-rays?
Yes, imaging can help.
Yeah.
X-rays, especially of the pelvis, the lower back, the long bones in the legs, they can sometimes show this specific kind of bony reaction.
Bony reaction.
Yeah, it's like new bone growth happening along the surface of the existing bone. We call it periosteal proliferation.
Ah.
And seeing that pattern in the right context can be a pretty strong clue for some dogs.
Okay, so blood work, maybe seeing the parasite, maybe these bone changes on x-ray. Those are strong hints. But what's the definitive confirmation? How do you know for sure?
The gold standard really involves two things. One is a muscle biopsy.
Taking a small sample of muscle.
Exactly. To look at under the microscope. And the other is a PCR test, polymerase chain reaction.
PCR, okay.
Yeah.
Like we hear about for other diseases.
Right. You can run it on blood or on that muscle tissue sample, and it basically looks for the parasite's specific DNA, its genetic fingerprint.
Gotcha. So that nails it down. Now, once it's confirmed, what's actually happening inside the poor dog? What does this parasite do to the body?
Right, the pathology. Well, often you see the dog is just in poor overall condition, that cachexia, the muscle wasting we talked about.
Yeah.
And when you look closely at the muscles, microscopically, you might find these really characteristic structures that look a bit like onion skins.
Onion skins.
Yeah, these are stages of the parasite called merons, and they're usually surrounded by a specific kind of inflammation. Pyogranulomatous myositis, it's like the guy who's trying to wall them off.
I see.
The liver and spleen might also be enlarged, and you could find those meron stages in there too, under the microscope. And of course, you look for that periosteal bone proliferation we might see on the x-rays.
Okay, that paints a clearer picture. Definitely a nasty situation for the dog. So what can we do about it? What's the treatment plan look like?
This is really crucial for people to understand. Right now, there's no known cure that totally eliminates the Hepatozoon americanum parasite.
Oh, no cure.
Not in the sense of completely eradicating it, no. So treatment really focuses on managing the symptoms, trying to get the dog into clinical remission.
Remission. So basically making them feel better, reducing the signs.
Exactly. Making them more comfortable, improving quality of life. If a dog's in severe pain, they might even need to be hospitalized initially just for pain control.
Right.
Pain management is a huge part of it, similar to how we manage pain for arthritis or other muscle and joint issues.
Makes sense.
And how active the dog is, their appetite. That often hinges on how well their pain is managed. And unfortunately, most dogs will probably need some kind of treatment ongoing, potentially lifelong.
Lifelong treatment. Wow, that's a significant commitment. What medications are we talking about?
So typically the approach is to start with a combination of 3 drugs for about 14 days. It's often called TCP therapy.
TCP.
Yeah, it stands for trimethoprim sulfadiazine,
Okay.
which is given by mouth twice a day, then clindamycin by mouth 3 times a day, and pyrimethamine by mouth once a day. Specific doses for each, of course.
Right. So 3 drugs for 2 weeks. Then what?
Then usually you transition to long-term therapy. The most common drug for this is called decokinate.
Decokinate.
Yep. Given by mouth, usually mixed in the food, twice a day. And this can go on for a very long time, months, maybe indefinitely, to keep things suppressed.
Okay. Are there any alternatives to that initial 3-drug combo?
Yes. There's another drug, pontogerol, that's shown some promise for that initial phase.
Pontogerol.
It's given twice a day for about 28 days. It can be effective for getting the initial symptoms under control. But even after using pontogerol, most dogs still seem to need that long-term decokinate afterwards to maintain remission.
I see. What about things like steroids or regular anti-inflammatories like NSAIDs? Do they help?
Well, glucocorticoid steroids, they might give some temporary relief from inflammation, but we generally don't recommend them routinely.
Why not?
There's actually some concern they could potentially make the disease worse in the long run.
Oh, okay. Good to know.
NSAIDs, the nonsteroidal anti-inflammatories, they could definitely be used to help manage pain and discomfort, but they're more of a supportive measure, not the primary attack on the parasite itself.
Right. Part of the bigger picture. So if a dog is diagnosed, starts this treatment, what's the outlook? And how do you even track if it's working if you can't fully eliminate the parasite?
Yeah, that's a challenge. Directly monitoring the parasite levels in chronically infected dogs is difficult. So really, the best way we monitor is by watching for clinical improvement.
So watching the dog.
Exactly. Is the lameness getting better? Is the stiffness improving? Is that fever gone and staying gone?
Appetite, energy levels.
Precisely. Is their appetite back?
Yeah.
Are they more energetic? Those are the signs that tell us the treatment is helping control the disease.
And prevention. What can owners actually do to stop their dogs from getting this in the first place?
Prevention really boils down to two key things. First, and most importantly, tick control. Consistent, effective tick control.
On the dog and in the environment.
Both. On the dog and in their environment, the yard, kennel areas, wherever they spend time. And second,
Yes.
try to prevent your dog from eating dead animals or from hunting prey, because that's how they could encounter those infected parotenic hosts we talked about.
Right, the rodents or whatever. Okay. Are there any potential complications during treatment owners should know about?
Well, like we mentioned, the potential issue with glucocorticoids possibly making things worse.
Okay.
And it's also worth remembering, even if a dog has hepatozoonosis, they might not always show those classic bone changes on x-rays.
So you can't rely solely on that.
Exactly. So bottom line,
Hmm.
treatment usually does improve the dog's signs, their quality of life,
Yeah.
but it's not a cure. Long-term management is very probable.
And if the symptoms come back,
If there's a clinical relapse, yes, we'd likely need to go back to that initial TCP or pontoseral protocol, followed again by the long-term decocchinate.
okay. So just to sort of wrap up the key points from this deep dive, canine hepatozoonosis, the Americanum type, is a serious tick-borne disease.
Oh.
Mostly dogs, mostly in the southern U.S.
That's right.
Shows up with things like lameness, that on and off fever, muscle wasting.
Yes.
Diagnosis involves putting puzzle pieces together, blood tests, maybe x-rays, definitely muscle biopsy or PCR,
The definitive tests.
and treatment. It's
Yeah.
about managing symptoms, improving life quality, but probably means lifelong medication like decocchinate,
That's the current reality,
Yeah.
yes. It manages, it doesn't eliminate.
which really highlights prevention again.
Absolutely. I really can't stress enough how vital consistent year-round tick prevention is,
Yeah.
especially if you're in those areas.
Yeah.
And if you do see any of these signs we've discussed, the stiffness, the fever, the eye discharge, the weight loss, please get your dog to the vet promptly. Early diagnosis and starting treatment can make a big difference.
Definitely. This has been super informative, clarifying a really complex and honestly quite scary potential diagnosis. Thinking about this whole discussion, especially how it relies on the dog eating the tick or eating an infected animal, it makes you wonder, doesn't it? Like, what other kinds of preventative measures beyond just killing ticks on the dog might be possible in the future? Could we target the parasite's life cycle in a different way?
An interesting thought.
And also, why those specific regions, what wider environmental factors, climate, tick populations, wildlife reservoirs might be playing into why this disease is so much more common in the South and Southeast.
Yeah, those are great questions. Definitely some food for thought about where research might go next.